Hello everyone and a very good morning. I am Dr. Chirag Chamria from Oral Maxillofacial. It is very stressful to go to a dentist, get your teeth examined with 4 teeth in your mouth, with so many metallic instruments, touching your teeth here and there. But you also know you have pain or you have a cavity or you have trouble or you have moving teeth or missing teeth. In this stressful environment, it sometimes becomes very difficult to understand what to ask from your dentist or from your consultant. This video is dedicated. When you typically visit your dentist for your consultation, you should be able to understand at what stage is your oral health. Do you require preventive care? Do you require curative care? Or do you require something which requires replacement or rehabilitation? Fundamentally, there are only two. Either I have everything which is working for me and I only need to prevent anything going bad. I have something which can be treated and preserved. We call it curative. And there is something which I have lost and I need to get it back, which is rehabilitative. So we need to understand at what stage you are on. So that is the first and primary question which you should be able to answer after your consultation. Second thing which is the most important is to understand the preventive care will take minimum amount of effort, minimum amount of cost. Whereas the last part, which is rehabilitative, it takes maximum amount of effort on your part as well as the doctor's part and maximum amount of monetary requirement which is going to be done. Therefore, you should not delay but visit your dentist at least every 6 months if not. You should ask your dentist what kind of diet would help me prevent dental diseases. I'm not only talking about cavity but gum diseases. I like chocolates. I still want to eat chocolates. But what can I do that these chocolates don't affect my oral health? These are certain preventive questions which you should ask your dentist. I have a cavity. Will filling this cavity help me today? Or can I wait about it? If I have lost a tooth, is it okay if it remains like this? For a couple of years I have lost a tooth and there is nothing wrong with me. Then why should I replace it today? These are certain important fundamental questions which you should have in your mind. There is ample of literature available online which says that if you don't replace one tooth in a matter of few years, how you start losing the neighboring tooth. And ultimately, in a matter of 10 to 15 years, you will lose all of it. Therefore, at this point of time, once we are clear with what preventive goals are, what our rehabilitative goals are, and what our conservative goals are, we can then proceed for the You should be completely aware and the question should be of this nature that we get done with the rehabilitative and the curative part as soon as possible and go on a long-term maintenance therapy for prevention of further diseases. So when you visit your dentist next time, take a piece of paper, make 3 columns, preventive, curative, rehabilitative, and note these points. Then when you go back home, you will have a complete roadmap in front of you. Certain specialties would be able to finish all 3 in the same sitting. Certain specialties would take time. There will be cost variations. There will be time commitment variations. There will be other variations as well. but at least we have a board in front of us that this is the oral health goal. Then based on your requirement, you can obviously adjust it, you can understand better, you can take multiple opinions and refine these goals. Ideally, these goals should be started as soon as you get your driving license, as soon as you are 18 years of age. Because prevention is always better than cure. It is not only cheaper, more cost efficient, but natural. And we as dentists only try to mimic nature. But we are not nature ourselves.